Hi guys, my name is Dr. Waldeck. I'm joined with Dr. Bob Grisa from Fairlawn and Dr. Sarah Jacobs in Huntsville. And we just wanted to touch on immunity for our patient base and what we're doing in our practices to make sure our equipment is sterile and we have a clean environment for our patients. And we're doing everything we can to help people get out of pain without having to go to a medical facility or urgent care, or worst case scenario, like a hospital, if they have like a disc bulge or a disc herniation, anything like that right now. So we can save those man hours that the hospitals and medical doctors are using for patients in critical care. So just to start, I just want to say it's generally known in medical practices and in healthcare that stress and pain have a long-term dampening effect on the immune function of the body. And long-term chronic stress can lead to increased production of cortisol, which has a negative effect on immune function. And we all want to do everything that we can right now to mitigate our risk of contracting COVID. And if, Lord forbid, we happen to contract it, we can keep those symptoms relatively mild and avoid hospital exposure if possible. So other things that we can do to be proactive are exercise and nutrition. And Dr. Grisa is an expert in nutrition in our field. And I just want to lead into you, Dr. Grisa. Thanks again for being on call with us. And I just want to ask you, just what are your biggest concerns that your patients are having in your office right now when they're coming in for treatment? And how are you addressing that with them?
Yeah, well, thank you, Alex, for getting this organized. I really appreciate it. First and foremost, I think our patients are concerned about, are we open? And yes, and then if we are, what measures are we taking? So I appreciate you hitting on that and how important sterilization is of all of our treatment tables and equipment and things like that to keep them safe. And then they want to know, are there things that they can do to prevent this from happening? And there's been a really great article that came out with Dr. Randy Cron from down by you all, actually, down in Alabama, out of University of Alabama at Birmingham, where he was trying to explain for both medical professionals and lay people exactly why some components of this coronavirus can be so frightening. And a part of that is something called a cytokine storm. And we don't really need to take the time to get into what that is, but essentially, when we get sick, our body reacts by either increasing inflammation or trying to decrease inflammation. And in the coronavirus, it really elevates the level of inflammation going on in our body. And so 3 things that I'm actually encouraging patients to avoid nutritionally right now are echinacea, honey, that's very popular in families who are trying to handle their nutrition holistically or their immunity holistically, is elderberry. And the reason being is those 3 supplements actually work to increase cytokine production. And so if we're exposed to this novel coronavirus and we do things to increase our cytokine production, it could potentially make some of those symptoms worse. So there are a lot of great opportunities nutritionally that we can take, or great steps that we can take to protect ourselves and decrease our inflammation. So some really easy ones would be Healthsource has a supportive supplement called HS Immune, which is primarily olive leaf extract. That's a great option. We also carry a really strong anti-inflammatory omega-3 supplement that can bring down that inflammation. And then taking steps that I'm sure Dr. Sarah is going to hit on as far as decreasing our inflammation through exercise and just taking those type of preventative measures. So.
Yes. Thank you so much. And I don't know if you guys out there, not many of you may know, but omega-3 is a precursor to a hormone that the body makes called resolvin. And resolvin does exactly what it sounds like it should do. It resolves the inflammatory phase of the inflammation cascade. So when you have a lot of these stressors in your system, there's a lot of increased inflammation in your body, and you need resolvin, and you can't synthesize that in the absence of omega-3. So that's why it's essential to take that nutrient and give your body those essential components so you can have that inflammation lowered so you can better adapt to that stress. And thank you for touching on that. And on that note, Sarah, can you talk to us about your biggest concern that your patients are expressing in the office and what they can do from an exercise standpoint to boost their immunity?
Mm-hmm. And similar across the board, people just are concerned about everything being sanitized properly. We also are limiting the amount of people in our clinic to 10 or less. So we have a 4-man team, so that means no more than 6 patients socially distanced from each other as well. So we have just added those measures in just for safety and precaution. In terms of exercise, a couple of things. If you have a prescribed home care program, we want you to continue that. And in addition to that, if you can perform 30 minutes of aerobic activity, so think you can carry on a conversation, so walking, biking, those types of activities, just 30 minutes a day can decrease your risk for cardiovascular disease and diabetes by 90%. So when we're looking at COVID-19, it's well known that when you have these other health issues, your risk greatly increases. So just looking at that 30 minutes a day, aerobic activity, that can help benefit your overall health, which would obviously then also boost immunity of some sort towards the COVID-19. The other thoughts that I have too is that if we're looking at increasing your core strength, which is how much endurance you have through that core belt around your midsection, how much endurance you have predicts whether or not your back pain is going to keep coming back. So in these times, it's great to go ahead and rev up core stability exercises. You can look up Pilates is a great way to increase that endurance through your core. Activities like yoga would be amazing for increasing your flexibility and mobility, which will also keep you feeling well during this time. I caution you, if you are doing very intense training with HIIT training or interval training, you want to keep it more at a moderate pace right now, just so that you're not taxing your system when we have all these other stressors going on in our lives. So the biggest thing though is just go out for a walk, enjoy the fresh air, get 30 minutes in, and that will help in a multiple amount of ways.
So yeah, Sarah, and you're saying that right now we should be avoiding like those high intensity interval trainings and severe, like heavy weightlifting and stuff like that, just because it may be too taxing right now. And we want to kind of do a lower intensity exercise for less stress on the immune system.
Mm-hmm. And I think you can still do interval type training, just don't max your effort full out. So I would say at a moderate pace would be a good idea.
Okay, good. And one of the other things too we wanted to touch on that you mentioned that our clinics are rolling out nationwide is the restriction based on CDC guidelines of 10 people in any small gathering. And we're doing the exact same thing in our clinic. We're restricting our patients to 6 to 7 max at any time, so we don't break that CDC guideline. So we are restricting our hours. So you're never going to run into an appointment where there's 8 or 10 or 12 other people in the office right now. We've all had to shift around our hours of availability to accommodate those guidelines. And it's just one of the things that we're doing at Healthsource, amongst our sanitization guidelines and sterilization between every patient visits, all the equipment, anything that can be touched. Check-in computers are removed just to keep people's hands off the keyboard and that kind of stuff, so we can do our part to reduce the risk of spread of this virus and also keep people's immune function high by eliminating stress and pain in their lives. And I just wanted to put this information out there. And did you guys have anything else that you wanted to touch on for your patients or anybody else that's curious? No? Good to go?
I think this is great. I think we're going to be able to continue to help a lot of patients and help them take some of these steps to prevent any of this from affecting them negatively.
Yeah, and just a note, as a general, most Healthsource offices are remaining open. I don't know of any closures that I can think of, and I've seen some other small businesses are starting to close, but we are deemed essential healthcare providers in our state boards. So that means we are essential to keeping people out of hospitals right now and out of medical practices, because I know not a lot of people are itching to go there unless they absolutely have to. So on that note, I want to thank you both for joining us here today. And if you guys have any questions for any of the doctors, feel free to post them down in the comments below. We'll read through all of those personally and address those to you as soon as we get this video up. And be happy, be healthy, keep the faith, wash your hands, and we will check you guys on the next video. Thank you guys so much.